think the housing professionals do need to raise the profile awareness around housing issues and make it in the consciousness of policymakers, decision makers, and indeed the general public. So if you ask people about health, people have an opinion on health. We know that health's the most important portfolio in terms of money. It gets over 50% of the devolved budget. So people have opinions about what the health service should look like, what they want from the health service, their expectations. But they don't really consciously think about housing in the same way. And I think that's where the housing professionals need to ensure that housing becomes part of the equation in terms of housing, health and social care, and that integration is more than simply integration within health or integration of health and social care, but it's about housing. I mean, what is more fundamental than where people live? Have they got a safe environment? Are they living independently? And again, it's about ensuring that when people are discussing health and social care, they're thinking about how do we ensure that the housing is there for people, it's what they want, it meets their expectations. I think a difficulty is in Northern Ireland we have a health minister, we have a health portfolio. People aren't quite sure where housing sits. We don't have a housing minister, we don't have a loud voice that champions housing, and it tends to fall between stools. So I think that's a difficulty for the professionals as well. So when they're lobbying, they have to think about who am I lobbying and what is my ask?